Lymphatic filariasis became a major global issue when it was realized by health authorities that this disease reduced productivity in the workplace, had significant adverse economic impact for countries, resulted in stigma being attached to persons living with lymphatic filariasis, and led to disabilities. It was decided at a global level that a disease such as lymphatic filariasis, which can be prevented, should be prevented. As such, it became part of the program for the elimination of neglected tropical diseases, with the aim of having its elimination in Guyana by 2020. However, this goal will most likely not be met, says PAHO WHO representative in Guyana, Dr. William Aducro.
But I must say that we have not, and I don't think we are going to be able to meet the elimination target of 2020. But it doesn't stop us from coming up with a revitalized plan to make sure that we have elimination at some point in time.
He explained that infection of lymphatic filariasis occurs when filarial parasites are transmitted to humans through mosquito bites. Although plans have not been going apace, it is expected that this elimination is recorded in Guyana between 2028 and 2029, since the fight to eradicate this disease has been intensified.
Hopefully, with this new revitalizing plan, it is my feeling that by 2028 we should be able to declare 2020, 2029. By the projections, we should be able to declare Guyana as LF-free.
Meanwhile, PAHO WHO Specialist in Vector Control Services, Dr. Jean Samefields-Alexandre, explained that it is quite a simple process for someone to contract lymphatic filariasis.
Is it contagious? Is it hereditary? How is it contracted, and how could it be prevented?
So filaria is, we like to call it a neglected infectious disease, but is also a vector-borne disease. That means this is a disease contracted when a vector, in this case a mosquito, get the parasite from one infected person and take it to a non-infected person. When someone gets infected, this person will not develop any symptomatology right away. First symptomatology in some cases appear 10, 20 years after infection. And when those symptomatologies start to appear, there's nothing we can do for it. So prevention is the best way to get rid of these diseases.
Dr. Alexandre emphasized that when someone gets infected with lymphatic filariasis, that person will not be aware of this, continues to live his or her life as per norm until it reaches the stage where symptoms are noticeable, but that before these symptoms manifest, the tablets can prevent chronic manifestation.
If I'm bitten by a mosquito and I become infected, before any signs of symptoms, there can be some form of treatment?
Exactly. Because the parasite, when it is in our body and we don't see it, it is doing something there. It is destroying something, and at the end, when we say at the end, because it's in the chronic phase of the disease, then you will see the manifestation. But while the parasite is there, before showing any symptomatology, if we kill it before it destroys our internal part, then we prevent the chronic manifestation.
He added that by taking the tablets, which are intended to kill filarial worms in the body, this act will benefit not only that individual, but help protect loved ones, family members, and society from contracting lymphatic filariasis.
I do two things. I am serving two people at the same time. I'm serving myself, preventing to get chronic manifestation, but I'm also serving the community, preventing to pass this parasite to anyone.
Reporting for HGP Nightly News, I am Kristen Macklingam.